Welcome to remotestrengthcoach.com. Today we'll be discussing soft tissue mobilization techniques used in elite athletes training programs. The purpose of the discussion today is not to go into any depth about each of these techniques. It's more or less to shed light on what elite athletes are actually using. We all know an elite athlete is going to have a well-devised strength conditioning program. They may also be following a meal plan assigned by a sports dietitian. Manual therapy is its own category and is a critical piece of an elite athlete's preparation for sport. Soft tissue mobilization techniques can be something that helps guard against injury, can ultimately help keep you performing at your best so that you get the most benefit from your training session. It may also free up some range of motion, allowing you better function. There are 4 categories of treatment that are most heavily used. I'll briefly overview each of them. The first technique is scraping. Scraping techniques often go by the name of either Graston or instrument-assisted soft tissue mobilization. These techniques involved using stainless steel instruments that are very dull and smooth. They are run over top of the muscle tissue. These tools help to align any misaligned muscle fibers. They may also help to alleviate any adhesions where adjacent muscle fibers may be stuck together and they're not gliding as smoothly as they should. The next category of treatment is dry needling and acupuncture. These techniques involve inserting a thin metal rod into the muscle tissue at the site of a trigger point. The insertion of the metal rod into the trigger point causes a twitch or cramping-like reaction, which is the muscle resetting itself. Next up is active release technique, also known as ART for short. This is a method where a practitioner will maybe use a thumb to create a false insertion or origin point within the tissue, and then take the patient either passively or actively through a range of motion to stretch that muscle out. This is another method that helps to alleviate trigger points. This technique has been around for quite a long time. ART is a brand, is a certification course, but ultimately a pin and stretch technique, which is very similar, has been used for many years by athletic trainers. The final and most popular treatment is massage. Athletes will receive both deep tissue or sports massage. They'll also receive flush massage. The deep tissue and sports massage generally are more aggressive treatment where they are looking to, again, break up trigger points, break up adhesions, help that muscle function better, decrease muscle tone. The flush massage serves to eliminate metabolic waste from the tissue, speeding up the recovery process. The scraping technique, dry needling technique, and the deep tissue massage are by far the most intensive treatment. These treatments are preferably scheduled prior to a rest day. Similar microtrauma can occur with these treatments, much like the trauma that occurs to the tissue during a hard weight training session. There generally aren't any contradictions to a athlete receiving ART and then rolling right into a training session. Also, a flush massage, both before or after a training session, is not that intensive and probably isn't going to actually create any damage within that tissue. So these can be done at any point in an athlete's weekly training program. If you are an aspiring athlete, you're welcome to do more research on these techniques. Maybe one of them could have some benefit to you. You're welcome to ask any questions of myself at remotestrengthcoach@gmail.com. Thanks for listening.